Hello, everyone. This is Dr. Samina Patan, and I'm here to present my paper on kidney tumor segmentation and using improved UNET architecture for early diagnosis of renal cell carcinoma for the 7th International Conference on Advances in Signal Processing and Artificial Intelligence. The paper is co-authored by two more authors, that is Dr. Tanveer Ali and Hanina Haider. We are from Manipal Institute of Technology, Manipal, India. So let me take you to the brief of the presentation. So this is the presentation outline, which we will be starting with the introduction, literature survey, research gaps, objectives, methodology, the result, scope, conclusion, and finally concluding with the references. Okay, to give you a brief about what exactly is a problem definition, it is like we are proposing a medical solution to a technical solution to a medical problem. So, as we all know, that the kidneys are vital organs located on either side of the spine below the rib cage, and they are responsible for filtering waste products and excess fluids from the blood from the urine. So they are very important part of our human body. And now a certain kind of malignancy, also called as a kidney tumor, further it's also renamed as renal tumor. So it's basically an abnormal growth of cells in the kidney. So these cells could be benign or as well as malignant, and potentially if they are left untreated, they can lead to a very of lot of fatalities among human beings. Yeah, so as far as this fatality is concerned, and talking about the prevalence and significance among towards the entire globe, we can see that this forms the 10th most common cancers, which is diagnosed in both men and women, and it accounts for 3 to 4% of adult cancer, and it has a very higher incidence rate in men compared to that of women. And basically its average diagnosis is usually done at the age of 64. So it's a very crucial for an early examination that helps us to detect the disease at an earlier stage. So we can also say that as far as the WHO statistics is concerned, around 18,000 180, that is 18,000 people have died due to kidney cancer every year in the year 2020. Okay, so as we all know that the significance of detecting tumor at an early stage is of crucial importance. This is because it gives us very improved treatment options. It helps in increasing the survival rates, and it also helps in preservation of kidney function, which is actually very crucial for our day-to-day life. In order to provide this, in order to provide an early diagnosis of this particular problem, we are offering certain technical solutions to overcome the challenge. The first important technical solution is improved accuracy for early detection. Yeah, early detection is not the only thing. We should have a very accurate rate of early detection, and considering this accurate rate of early detection, we are also talking about having an enhanced treatment plan. Okay, and we can further take this down to areas where there are very lower healthcare facilities, such that gives a go-to solutions in before undergoing any kind of biopsies or something. People can take up this as a second opinion. That is, experts can take up this as a second opinion in order to before they go for the further diagnosis. Okay, so in this regard, we have gone through few of the papers which are actually available in literature. The state-of-art techniques have usually employed most of the CNN and deep learning based model. In addition to that, they are also certain ML models. You can see the first step, whatever is being there in this particular diagnosis, whenever you are trying to develop a CAD tool, the first step forms the segmentation. Yeah, so we take the image, we pre-process it, and then we segment it, and finally we go to the diagnosis, whether we it depends upon what kind of category it belongs to. Okay, so segmentation, that is detection of ROI, plays a very crucial step. So in this regard, few of the state of art techniques have been explored, and we have I'm not going through all of the techniques which are there in literature. I have probably cited them. Yeah, so I'll just brief up the summary. What exactly are the research gaps that we have found in the state of art techniques? The first thing is that there is a lack of automation method for segmentation. There were experts who are were actually finding it difficult to automate the process of segmentation, and then there were certain they had to come up with certain manual methods in order to do this. So the need for automation is one important crucial criteria. Next thing is that most of the methods lacked a balance in sensitivity and specificity in determining the ROI. So when I talk about sensitivity, it usually indicates that if I want to identify the area of interest, the accurate area of interest, that's where I'm going to actually categorize sensitivity as a evaluation metric, and the non-ROI region, accurately classifying the non-ROI region, is the specificity. Okay, so the next step is there are insufficient methods that use size for classification of tumor into stages, and hence all of these methods, due to lack of all of these methods, there was very decreased value of accuracy that was obtained for segmentation. And in order to improve this, we have formulated three different objectives. Basically, it was to summarize, we have to develop a deep learning algorithm capable of accurately segmenting the kidney tumors from medical imaging data, ensuring precise delineation of tumor boundaries, conducting a comprehensive comparative analysis to the state-of-art techniques, and finally to implement a size measurement mechanism to classify the segmented tumors into its distinct stages. So this is what the objectives that were set up during the presentation, and this is the overall methodology. We acquire the data, we pre-process the data, we perform certain data pre-processing on the data to make it suitable for the algorithm. And since the data is very small, we have a very imbalanced kind of data, we go for data augmentation as we are applying deep learning techniques, and then finally segmentation, and then tumor analysis based on size. So to go about with the dataset description, this is the dataset. The dataset was a collection of multi-phase CT imaging segmentation tasks from about 210 patients, and they were in the Nifty format. So getting it into its appropriate format is one of the main tasks. So this is the day image, and you can see there is a tumor that is present that is highlighted with yellow and green color. That's what the label, annotated label. So we started with size-based inclusions. Okay, so we filtered out CT scans which had a depth of more than 500 pixels, and then we performed min-max scaling and finally cropping. And in order to ensure a balanced data set, we had gone for certain data augmentation with such that the data was rotated with random flips and rotations of images up to 290 degrees. Yeah, okay. So once the this has been done, you can see the patches of the CT scan and the corresponding respective labels after it's been performed. Okay, so you can see that we have employed an initial unit architecture with certain hyperparameter optimization to tune into our specific requirements. I've just given the encoder and decoder stage a general structure. The first layer starts with the input layer, where the input layer receives the input data typically in the form of image volumes, and then we have the contracting path and the expansive path, also termed as the encoder and decoder, and finally we have the output layers. Okay, to go about with the autoencoder, the job of the encoder is to extract the features from the images, thereby reducing the image in height and width by simultaneously growing it in depth, and then finally we apply the decoder. So these are the parameters that were used for training the data for the unit architecture. And finally, we come up to the main task of determining the tumor size. So in order to do the tumor size or perform a size-based analysis, we convert the pixels into using the particular formula. There's the equation 1 that's been given. It's been proposed by us. And finally, we have the various categorization categorized into T1A, T1B, T2A, and T2B. You can see for various sizes in centimeters, you have various values. Finally, we go about with the performance metrics to determine the dice score, the dice loss, Jaccard index. All of this validation is done with respect to the ground truth that is available in the data set. Okay, and in order to perform a comparison, we also have been compared it with VNet and attention unit model and the autoencoder architectures, and we can see that the dice loss is very much less in case of the in case of unit, the proposed unit model, and the IVU score is also very good with respect to the unit model, and comparably we get a better dice score. You can see from the graphical illustration, this unit architecture had all the optimized parameters in contrast to the existing transfer learning models. So these are the few of the outputs graphically illustrated with the segmentation masks. As you can see in both the cases, one is the ground truth as well as the prediction. We can see that the ground truth and the prediction both go well hand in hand, with most of them quietly seen appropriately. Yeah. So the scope of this particular feature work is that we can take this up further. First is that we can improve the model such that we can apply more amount of hyperparameter tuning to suit this for a particular data set. Next is that the thing is that we can take this up